This is a demonstration on how to document existing restorations and suspects in your patient in Eagelsoft. Make sure that you are in your patient's chart by the name and or the ID number at the top, and then you're going to navigate up to the upper ribbon where it says chart. When you click on that, if this recare reminder comes up, just go ahead and exit or press OK. This screen is going to appear. On the left-hand side, you're going to be able to see some x-rays that are going to help navigate you with the appropriate restorations or suspects that need documentation. And on the right side, you're going to see everything that we're going to be using to be able to enter in this information. The first thing that I do is always determine which teeth are missing or unerupted. So I am going to say that number 1, 16, 17, and 32 are missing. So I'm going to highlight all of these teeth. I'm going to go over to the right side where it says missing. I'm going to do the drop down box and I'm going to select missing tooth. When that happens, this screen is going to appear and all you're going to do is click OK. That is going to turn all the teeth that are missing black. The other couple ones that are very common is, let's start with resin. Resin is composite. And when you click on that downward arrow, there's going to be anterior and posterior and different surfaces. So you have to determine on what surfaces are affected and whether it's anterior or posterior. So I'm going to go to number 3. I'm going to highlight number 3 because number 3 has an MO composite. So I'm going to highlight number 3, and then I'm going to come over to resin. I'm going to click on that downward arrow, and I am going to go find the resin for 2 surface posterior. I'm going to select this one. And when that happens, this screen will appear, and you'll see the service code, and you're going to see it's a resin-based composite 2 surface post. Now this is an existing filling, so I'm going to make sure that I select existing. Then down here on this bottom, the surfaces that have the composite is going to be the MO. I highlight those 2 and then I'm going to press OK. You're going to notice 2 things. First, you're going to see that this area is blue. You're also going to see it down here. You can also see the missing teeth that I've already documented. If I do an anterior, let's just say number 8 has an MIL. I'm going to select number 8. I'm going to go to resin, and I'm going to look for that 3 surface anterior resin. I'm going to make sure that it's an existing, and I'm going to select the M, the I, and the L for MIL. And I'm going to select OK. Again, you're going to see the composite right here, and you're also going to see it down here. The other very common one is amalgam, so AMALG. If we do the click down on here, you're going to see that we have different surfaces. So I'm going to go ahead and click on number 12. I'm going to say number 12 has an MOD amalgam, so that's a 3 surface. I'm going to select amalgam 3 surface. I'm going to make sure that it's existing, and I'm going to do MOD. I'm going to hit OK, and you're going to notice that it's a little bit more darker blue. So that's kind of how you're going to see the difference between it. So if you're just looking at the chart, the composites are going to be a little lighter than the amalgam. And you'll also see it down here in the box. Crowns are another common one. So let's just say number 13 has a crown. I've looked at the x-rays and I'm going to say that it is an all porcelain crown. So I'm going to go to crown and do the downward arrow, and there is so many different types of crowns. I said that my patient had an all porcelain crown, so that is going to be 2740, and that is going to say crown porcelain. I click on that, make sure it's existing, and I press OK, and then you're going to see the crown there. Let's say number 13 also has a root canal. I'm going to go ahead and select number 13. And RCT, that means root canal, downward arrow, and it's going to give me the option between anterior, bicuspid, or a molar. Since number 13 is a bicuspid, I'm going to select that, make sure that it's existing, and I'm going to press OK. And you're going to notice right there that there's a root canal. Another common thing that we do see is we see lingual retainers. So lingual retainers are very common on the lower anterior. So I'm going to highlight 22 to 27. And right here, I'm going to do that downward arrow again, and I am going to select orthodontic retention lingual bar. It is existing. I'm going to press OK. And then there's your lingual bar. Now, if your patient has implants, implants are right here. If a tooth has been extracted, it's right here. So, and then we also have conditions. So if there's an area that you can't find, you can also try to find it in conditions. One thing I wanted to show is how to place a suspect. Now, at Herzing University, we do not diagnose any areas of possible decay. We take our x-rays and we document the suspects, and then we give the oral health assessment report to the patient, and the patient is to go back to their dentist to have these areas evaluated and treated if needed. So we still document all suspects. So I'm going to say that number 4 has an MO suspect that I can see on the radiograph. So I'm going to select number 4. And I'm going to come over here where it says SC, and that says suspect decay. If you kind of hover over it, downward arrow, I'm going to click on it. And now what I'm going to do is, I said that it had a suspect on the MO. So I'm going to say MO, and I'm going to press OK. Do you see how it turned red? The reason it turns red is because it helps kind of raise awareness that this tooth needs possible treatment. So let's do that on number 5. And let's say number 5 has a DO suspect. So I'm going to highlight number 5. I'm going to select suspect decay, and I'm going to say DO. I'm going to press OK, and then you're going to see those there. Now, when you come down to the box, you're going to notice that everything is really out of order. If you select tooth and just click on tooth twice, it puts all of your teeth in proper order so that when you are reciting this information to your instructor, you can just go right down here and state to the instructor what you see versus looking at the bigger chart. This kind of gives us a better idea and gives it more of a level of understanding, more efficiency when you are actually stating this to your instructor. And I hope this helped. Thank you.